There are 3 companies that have made important commitments to leverage core business interests. The first one is Nuru Energy, and I'm looking at Sameer. He tells me that in Holland, where I come from, as you can tell, he's called Hajee, but it's originally an Indian name, so it's Hajee. So Hajee, Sameer, it's a fantastic company that you have with 2 million people living off the grid, and we're looking to find affordable, safe light sources. Maybe I can allow you to introduce your commitment. Do you have a mic there? We can share the mic. Why don't you? Here, there are 2 here. Come on up.
3 minutes.
It doesn't tell me how many minutes you have.
Okay. Right.
We have 2 more to introduce.
Okay. 2 minutes? Okay, I'll do my best here. My name is Sameer Hajee. I'm the CEO of Nuru Energy. We were founded in 2008 with a grant from the World Bank Lighting Africa initiative. The World Bank at the time was looking for innovative lighting solutions to tackle the problem of energy poverty, the fact that 2 billion people still do not have access to electricity, unfortunately. And so we came to the table with a very unique kind of proposition, and we received this grant funding. And as part of that initial initiative, we spent about 2 months living in a village in Rwanda, really trying to understand what are the unique energy needs of these 2 billion people. They certainly don't need to charge their iPods and their iPads. What in particular do they want energy for? And it turns out that they have very basic energy needs: cooking, lighting, recharging mobile phones, and that's the majority of the 2 billion people. So we thought, well, let's figure out on the lighting side, because that's what we got the grant for. Let's figure out what it is that they use for lighting, how do they use light, and what we determined was that 90% of this population uses kerosene. Right? Kerosene is unhealthy, it's unsafe, it's environmentally unfriendly, it's expensive, it consumes more than 25% of a household's income. And if it's so terrible, why do households continually buy this terrible fuel? And so that was really our kind of design challenge as a product development firm. What are some of the characteristics of kerosene and the way kerosene is delivered that we can maybe mimic and develop a new product around? So we determined that kerosene, the customers liked the fact that it was portable. They could use it outside, inside. They liked the fact that it was reliable, and by that they mean if there's kerosene and you light it, it reliably will give you light. They liked the fact that you could buy it in increments, and I think that was a really important kind of observation, because if you're earning less than $1 a day, you want to make sure that you don't have high upfront costs. So if you've earned 50 cents that day, you buy 50 milliliters. If you haven't earned any money, you don't buy any kerosene. So the fact that you can buy it as and when you have money was a really important observation. And the last observation was that they use lighting for tasks primarily, just to get the job done: cooking, studying, attending to baby, walking to the bathroom in the middle of the night. So we took all of that learning, and we developed essentially a very efficient, inexpensive task light, which we're calling the Nuru light. It on its own satisfies 90% of a household lighting needs, which is task-based. But as and when you have money, as and when you have a need for more light, you can actually connect them together and then actually light up a room with them. So the modular light innovation was created because of our time in the field. And then we started to look at reliability. Reliability is really important. How are these things charged? We certainly looked at solar, and if these populations are looking for cost-effective, reliable energy sources, solar, we believe, is still a very expensive energy source, particularly for these basic pyramid populations. It's not very efficient. Only 10% of the sun's rays get converted to electricity, so it takes a very long time to charge anything with a solar panel. So we kind of looked at the landscape to say, what is the energy source here that is widely available? And human power came to mind. So, human power is available anytime, anywhere. It is virtually free. If we could harness human energy and convert it into usable electricity and deliver it to provide these low-power energy services, would that not be a game-changing technology? And so that's exactly what we did. We developed the world's first commercially available pedal generator, power cycle generator. Recharges 5 lights in 20 minutes. Each light giving 40 hours of light, 10 days of light to a rural household. And the way we're delivering this technology to the communities is through rural village-level entrepreneurs. An entrepreneur gets a power cycle pedal generator via microfinance loan, 50 lights. He or she sells the lights to the community. They're about $6 each retail. And then those customers come back to that entrepreneur for recharging. In the 20 minutes that this entrepreneur spends on the power cycle, he's able to earn about $1.50, 30 cents per recharge for 10 days of light, which is 10 times cheaper for the customer. And basically in 20 minutes, this entrepreneur is able to earn what they earned in a day before. So huge value proposition along the value chain. And so our commitment as part of being included in the business call to action is to expand our initiative, which is currently in Rwanda, to the other countries in Eastern Africa, Rwanda, Kenya, Uganda, Tanzania, expand our network to 10,000 entrepreneurs, deliver 3.5 million lights through that network, and impact the lives of over 9 million households, 9 million people.
Fantastic.
Thank you.
Thank you. I think it's, one can only be but overawed by the power of a seemingly simple idea taken to scale and obviously on offer, and having that business side to it as well. Now my next fellow member whom I'd like to introduce is CEO Enrique Coronado for Porti Familia, and he will talk about a pledge to create a more efficient healthcare medicine distribution channel to benefit roughly up to 300,000 urban poor in Peru. Thank you so much, Enrique. Please.
Good morning, everybody. My name is Enrique Coronado, and I am the CEO and co-founder of Porti Familia. So why are we here? Well, Porti Familia is a private sector solution to the inefficient distribution channels for medicines and healthcare that have restricted access to a large number of people in Peru, especially middle to lower income people. So how do we do it? No, or what do we do, better said? We have set up a network of retail storefronts that combine the services of a doctor's office, a pharmacy, and lab testing services. And in this way, we can provide quality assurance to generic medicines and drastically lower the cost of healthcare while achieving economic sustainability. But more importantly than what we do is how we do it, because innovation today is more so on how we do things. So we think that a sustainable and a successful healthcare model is one that encourages people to take better care of their health. So what we do is, while we scale up our operations and open a number of locations, we also outreach, have developed some community outreach programs to encourage people to take better care of themselves. And by doing that, we will contribute to bridging the gap of those ones who can afford quality care at this moment, and then those who can't. Finally, always focusing on our mission to providing affordable quality healthcare through a sustainable and replicable model, we, Porti Familia, commit to supporting the achievement of the Millennium Development Goals number 4 and 5 by aiming to become the first call for routine care by providing access to around 270,000 people to primary care, especially mothers and children, and at the same time training 800 doctors, nurses, and pharmacists, and trying to reduce the exclusion of a significant segment of the population to accessing the healthcare system by opening 100 locations by 2015. Thank you very much.
Thank you very much. We move from light to healthcare to another area of medical care. And I'm looking at Dimagi. And Neal Lesh will present a Massachusetts-based technology firm which is looking at to address the gap in basic medical care through innovative mobile phone-based application called ComCare. I think a lot of other countries can benefit from that too. Here you go.
Thanks very much. My name is Neal Lesh. I'm the Chief Strategy Officer of Dimagi. It's great to be here. We're a small tech consultancy that's been building simple data systems and phone-based tools for health workers since about 2002 in low-income countries. We've worked in about 25 countries, and over the last 4 years, we've really been focusing on open source product called ComCare that is software that runs on a simple phone for use by community health workers. As many of you may know, quite a lot of public health programs rely on community health workers to do outreach, health promotion, and referrals, and some simple treatment. Community health programs have been repeatedly shown to be able to make tremendous improvements in health, often, particularly in reducing neonatal mortality and improving maternal health when they're well run. But community health programs are extremely challenging to run. You have distributed workforces, poor supervision, generally not very much education or training among the staff themselves. And so CommCare is a simple software that runs on phone. It contains checklists, client lists, videos, and other multimedia aids, and the data synchronizes with our cloud-based software so that we can track what the community health workers are doing, as well as provide decision support and a credibility enhancement tool on the phone. We've been working on it for about the last 4 years, mostly in sub-Saharan Africa, but a year ago, with funding from the USAID Development Innovation Ventures Fund, we've shifted to launch in India, or we're still working on the other projects, but we've really had a big focus on India, where there's a lot of properties that make it able to rapidly expand there. By the end of the year, we expect to be working in 8 states with about 10 different partners. We're especially excited to be working with in Bihar as part of the large Gates-funded initiative to really do statewide health reform of the health sector, and CommCare is one of the 2 technologies that's been used to support that. And our goal is to expand. India has about 750,000 ASHA's trained community health workers of a particular cadre that do a lot of focus on maternal and child health. Our goal is to have CommCare used by 70,000 of them in 3 or 4 years, which in turn would support about 7 million people. Thank you.